everyone. Today's topic will be a continuation of the previous class, that is part 2 of Hansen's. Today we'll be covering more of complications of leprosy along with the reactions and deformities. Okay. So what is lepra reaction? It's an acute episode or bouts of exacerbation occurring in course of chronic Hansen's disease. It is a sudden tissue response resulting from liberation of bacilli or their products into the tissue, which manifests as local or systemic complaints. It is due to the dead bacilli. Sudden increase in activity of existing lesions, appearance of fresh lesions with or without constitutional symptoms. Type 1 Lepra reaction, which happens in borderline tuberculoid, mid-borderline and borderline lepromatous, whereas type 2 reaction will occur in lepromatous leprosy and some cases of borderline leprosy. So what are the precipitating factors which you have to keep in mind are pregnancy and lactation. Anti-leprosy drugs per se will cause reactions. Why? Because once you start the anti-leprosy drugs, bacilli will get destroyed and the broken bacilli products itself can cause reaction. Iodides, severe physical or mental stress, surgery or any infections, alcohol. These are the few precipitating factors which can precipitate lepra reaction. So coming to the type 1 reaction, it is more so due to the type 4 hypersensitivity reaction. There are subtypes in it. One is upgrading, that is reversal reaction, or downgrading reaction. What are the clinical features in this is that the existing Hansen's lesion may worsen or new lesions may appear which may have characteristic feature of tuberculoid leprosy. So lesions may become erythematous, edematous and few may ulcerate also. Neuritis is a definitive feature along with sometimes nerve abscess. Systemic disturbances are very unusual in type 1 reaction. How do you diagnose this? Clinically, as I mentioned before, you have to look for the erythema, edema, tenderness of the existing lesions and then look for neuritis, nerve abscess. Along with that, check for any development of fresh lesions which are suggestive of tuberculoid leprosy. The second option is sending histopathology specimen, that is skin biopsy specimen for histopathological studies, in which you will get to see epithelioid cell granuloma, dermal edema, plasma cell and foreign body giant cells. What are the complications in case of type 1 reaction is neuritis, dactylitis, edema of the hands and feet, corneal anesthesia, conjunctivitis, sudden occurrence of nerve deformities like claw hand or foot drop or facial palsy. So type 1 reaction, here in this picture you can see, in the first picture the patch is erythematous, okay, edematous, and the second picture you can see the enlarged greater auricular nerve, and the nodulation what you can see faintly is nothing but the nerve abscess. It is better felt than seen nerve abscess. Type 2 reaction, it is also known as Erythema nodosum leprosum. In short, it is ENL. It occurs in borderline lepromatous and lepromatous leprosy cases. It's a type 3 hypersensitivity reaction. Here, the lesions clinically present as crops of tender, warm, recurrent, evanescent erythematous nodules distributed bilaterally, symmetrically located on the thighs, legs and face. Vesicular lesions can also occur which may break down to form ulcers. These are called as erythema necroticans. ENL will have constitutional symptoms like fever, malaise, headache and joint pain. Other manifestations include rhinitis, epistaxis, iridocyclitis, episcleritis, dactylitis, epididymoarthritis, arthritis, neuritis and lymphadenitis. How do you diagnose? Clinically, the first and foremost is you have to look for the constitutional symptoms, and apart from the Hansen's patches, you will get to see multiple tender erythematous nodules on the body. So, slit skin smear will show broken bacilli definitely, because it is seen in borderline lepromatous and lepromatous leprosy, and on biopsy they'll have vasculitic features, that is inflammation of the vessel wall. Surrounding to the vessel wall, the cutaneous vessel walls, there will be inflammatory infiltrate. These are the pictures showing erythema, nodosum, leprosum. The first picture you can see multiple erythematous nodules distributed on the body. The second picture is showing the same nodules with ulcerations. So if it gets ulcerated, then it is called necrotic ENL or erythema necroticans. Type 2 reactions, complications include frozen hand, laryngitis, non-paralytic deformity, polyarthritis or rheumatoid arthritis like syndrome, multiple dactylitis, leukocytosis, anemia, raised ESR, albuminuria, nephrotic syndrome like picture, liver, spleen enlargement, epididymitis, orchitis, testicular atrophy leading to sterility. Due to testicular atrophy, there will be reduced testosterone, hence they can have gynecomastia also, along with adrenal gland hypofunction and eye involvement. The complications I have already mentioned before. Type 3 reaction. This is a very rare form of reaction observed only in lucio-leprosy. Lucio-leprosy per se is very rare. That is also known as lepra bonita, which I have mentioned you in the last class. There is, because of the diffuse infiltration of the skin will become stretched and they look beautiful without any skin markings. So in that form of lucio-leprosy, you will get to see type 3 reaction or lucio phenomena. Here clinically you will get to see acute severe necrotizing vasculitis occurring in patients of Mexican ancestry, presents as painful erythematous patches that become necrotic and ulcerated. Treatment of lepra reaction, the main principles include early initiation of the treatment for reaction. Otherwise, they'll end up in neuritis complications. Continuation or initiation of multi-drug therapy, because some people will develop after the onset of MDT treatment. Removal of precipitating factors, rest, physical and mental health should be taken care. Treatment modalities. If it's a mild reaction, you can just treat them with analgesics like aspirin, that is, or paracetamol, or any NSAIDs for that matter. If it's a severe reaction, then you have to start them on corticosteroids like prednisolone. The WHO states you have to start prednisolone 40 mg for 2 weeks, then 30 mg for 2 weeks, 20 mg for 2 weeks, followed by 15 mg 2 weeks, 10 mg 2 weeks and 5 mg 2 weeks. Okay, that is how it has to be tapered. Antimalarials like HCQS can be started. Clofazimine is already a drug in MDT. Along with that, the dose of the clofazimine is increased in treatment of reaction. That is, initially you have to start with 100 mg 3 times daily, then slowly taper it down to 100 mg OD. Thalidomide is another drug in case of treating reactions. The other steroid-sparing agents will include methotrexate, cyclosporin, azathioprine, and mycophenolate mofetil, just to reduce the steroid side effects in these cases of lepra reactions. Supportive management include, it can be surgical decompression of the nerves, the tender nerves, or if they have any splints or padding, treatment of steroids or atropine eye drops for iridocyclitis, steroid or scrotal support for epididymo-orchitis. The newer drug for erythema nodosum leprosum include leukotriene inhibitors, thalidomide derivatives, and infliximab. So part 1 is of the complications we have dealt with. That is very important is type 1 and type 2 reaction, which has to be very well managed, otherwise the patient will have deformities and disabilities. Deformity, it is defined as visible alteration in the appearance which results in disability. Disability defined as restriction or lack of ability to perform an activity which is considered as a normal for a human being. Primary and secondary. So primary are caused by the tissue reaction to the infection with M. leprae, that is leonine facies, flat nose, claw hand. Secondary ones occur as a result of damage to the anesthetic parts of the body, that is plantar ulcers or corneal ulcers. Grading of deformity and disability according to WHO is graded as grade 0, 1 and 2. So grade 0, they will not be having any anesthesia, no visible deformity or damage in hands and feet, and no eyesight problems or no visual loss. So that is grade 0. Grade 1 is anesthesia of the anesthesia with no visible deformity or damage, eye problem due to leprosy present, but vision is not severely affected, 6/60 or better than this. Can count finger at a distance of 6 meters. Grade 2 deformity is nothing but visible deformity or damage present in hands and feet, severe visual impairment that is worse than 6/60, nothing but unable to count fingers at 6 meters of distance, lack of thalamus, iridocyclitis or corneal opacities. So when you get a Hansen's case with deformities, you have to grade them into grade 0, 1 and 2 depending on the deformity present in that particular patient. So coming to the deformities. What are the primary deformities? Leonine facies, which I have already mentioned earlier, that is increased in the skin markings on the forehead due to the infiltration, and there is infiltration of the earlobes along with madarosis, that is lateral 1/3 of the eyebrows will be lost. So that gives the look of a lion in these patients. So that is one of the loss of eyebrows and eyelashes, depressed nose along with loss of incisors is called as facies leprosa. Gynecomastia, it usually happens as a complication of epididymo-orchitis. Palatal perforation. The secondary deformities are corneal ulcer and opacities, plantar ulcers due to the loss of sensation, palmar ulcers, ulcers on the tip of fingers, resorption of the fingers, Charcot joints. The picture what you are seeing is a trophic ulcer. Deformities due to the nerve damage. First, it can be claw hand. If it is only one nerve is involved, then it is partial claw hand, either ulnar nerve or median nerve. If both are involved, then it is called complete claw hand. Clawing of the toes due to the involvement of the posterior tibial nerve. Wrist drop is due to the radial nerve. Foot drop is due to lateral popliteal nerve. Lag of thalamus or facial palsy due to the facial nerve involvement. In the picture, you can see the claw hand, wherein there is hyperextension at the metacarpophalangeal joint and flexion of the proximal interphalangeal joints. Trophic ulcer. So trophic ulcer signifies there is nerve involvement. Okay, it can be present in any of the neuropathies, but in case of Hansen's, along with the Hansen's clinical feature, cardinal features, there will be nerve involvement, sensory loss, due to which they'll have development of trophic ulcers. So the stages include, first will be threatened ulcer, wherein the process of the tissue damage starts associated with inflammation. It presents as edema and warmth in that region of metatarsal head with associated deep tenderness and increase in interdigital gap. Concealed ulcer, it is damage to the subcutaneous tissue, presents as necrosis and blisters at the site of damage. Open ulceration, finally when the skin breaks down, tissue damage site is exposed to form frank ulcer. Types of ulcers are acute ulcer or chronic ulcer, complicated or uncomplicated ulcer. How do you prevent the deformities? Adequate treatment of leprosy patient, early detection of the nerve damage and prevention of the nerve damage, educate the patient about hand and foot care, protection of the anesthetic hands from injury, care of the hands with weakness and paralysis, use of protective soft footwears, adequate hydration of the skin along with physiotherapy if they have any deformities. How to manage? First is educating the patient regarding the prevention of these injuries due to the sensory loss. Daily examination of the hands and feet, prompt treatment even if the injury is very small. Using adapted tools or appliances after training. Reconstructive surgeries and rehabilitation of these patients. Physiotherapy. So, first is the oil massage or wax therapy. The uses are to make the skin soft and supple, to loosen the stiff joints. As a preliminary to exercises, to strengthen the muscles, keep the joints mobile, and also to reduce the pain in acute neuritis. It also stimulates innervated sweat glands to increase blood flow. Exercises are of two types: active exercise and assisted exercise. It is done to increase the strength of the muscles and retain their tone. Electric stimulation to maintain the tone of denervated muscles, helpful in breaking post-operative adhesions. Before tendon surgery could be used as means of documenting nerve damage and the progress of the nerve recovery with treatment. Splints. Indication: acute neuritis, mobile deformities to prevent fixed deformities, and fixed deformities to correct the deformities. Various splints will be: for radial neuritis, there is static or dynamic wrist drop splint. For mobile deformities, there is static or dynamic splint. For fixed deformities, there are gutter splints, finger loops, etc. Splints for various deformities like hand deformities, it is gutter splints, finger loop splints, opponent splints, and abductor bands. For foot deformity, it is Y strap with spring, single elastic strap. How to prevent and control leprosy? Prevention of leprosy is by early detection through survey, initiation of MDT treatment, contact survey, and families of the patients to be kept under surveillance, immunoprophylaxis by using leprosy vaccines, improvement in their socio-economic conditions. Leprosy control activities will involve three activities, that is case detection, case holding and including treatment, health education of public and patients. Leprosy organizations include UNICEF, Lepra, Danida, SIDA, Leprosy Machine, American Leprosy Machine, German Leprosy Relief Association, Lepra, Netherlands Leprosy Relief. Leprosy control programs include National Leprosy Control Program. It started in 1954. Triad of survey, education and treatment. National Leprosy Eradication Program. It is what we are following right now. NLEP started in 1982. Prevention and control of leprosy. National Leprosy Eradication Program can come as a short note for you. So it started in 1982. Eradication of leprosy from the country by 2000. Vertical health programs in areas where prevalence of leprosy is more than 5 per thousand. Horizontal programs in which the prevalence rate is less than 5 per thousand. Three main units of this program include basic tier, that is survey, education and treatment unit, leprosy control unit and urban leprosy control unit. Second tier will include district or zonal leprosy office. Third tier include leprosy division of the state directorate of the health services. Coming to the rehabilitation in leprosy. Physical and mental restoration of patients to normal activities so that they are able to assume their place in home, society and also in the industry. Treatment of physical disability, education of the family, public and the community, along with rehabilitation in special homes or institutional rehabilitation. Community-based rehabilitation is also done. So there are a few MCQs depending on the topic which has already been taken. So this completes Hansen's part 1 and part 2. Thank you.